Hello, everybody. My name is Tyler Whipke. I'm the Director of Mission and Spiritual Care at St. Luke's Health in the Woodlands. And welcome to this episode of Conversations for the Common Good. And today we are joined by Mack Praytor. And Mack, why don't you go ahead and introduce yourself? I understand that you were with Raquel while I was out on military leave, but this is my first time having a conversation with you.
Well, thanks for the introduction, Tyler. I appreciate that. And my name is Mack Praytor. I'm the Mission Integration and Spiritual Care Coordinator at Patients Medical Center in beautiful downtown Pasadena, Texas, at our CHI St. Luke's Patients Medical Center.
Well, Mac, we're glad that you're with us today, and I'm even more thrilled that you've brought something to share with our listeners and our viewers. And the whole reason we started this series of conversations for the common good was to help address the needs of ourselves and our patients, and just to deal with the craziness that's kind of been going on as we keep continued walk through this time of pandemic, and offering good quality healthcare to those around us, and also acknowledging that it can take a toll on us as well. And so today we're going to be talking about toxic positivity. And Mac, I just wonder, could you tell us what is toxic positivity?
All right. Well, thanks for introducing the topic today, Tyler. Um, Being positive, generally speaking, is a good thing. Um, there are studies that have been done, a number of them, that show there are better outcomes with folks who have a positive attitude when it comes to illness and recovery. As a matter of fact, a lady by the name of Lisa Yannick at Johns Hopkins did a study, and it revealed that even in people with a family history of high risk factors for coronary artery disease, uh, if they considered themselves to have a positive attitude, they were 13% less likely than their negative counterparts to have a heart attack or other coronary event. And there have been other studies that reveal that having a positive attitude helps outcomes. There's a very strong link between having a positive attitude and having good health. And it's across the spectrum, especially in things like traumatic brain injury, stroke, and brain tumors. However, depending upon the situation, uh, a positivity in itself can become a negative thing. It can become toxic.
Really? So if being positive can be attributed to better outcomes, I'm struggling to see how it can be considered toxic. Can you unpack that just a little bit?
Sure, I'll be happy to. Um, the thing is, there's a difference between having a positive attitude and what's considered toxic positivity. And I think the answer primarily lies with the severity of the situation. So, for example, if someone is telling you to cheer up or just think happy things, happy thoughts, that may work if you ruined a recipe that you're working on, something new that you're trying to create in the kitchen. Or maybe you've had a minor fender bender and someone says, oh, just cheer up, it'll be okay. Well, that might work in those situations. But it's completely different when you're dealing with a significant loss, a traumatic situation, or a death in the family. Those sorts of situations is when that kind of, oh, just cheer up, it'll be okay sort of statements can be negative. Um, so positivity becomes toxic when it's used as an avoidance strategy, used to push away or invalidate people's emotions because of that internal conflict, and they're uncomfortable with that. And so they shove those emotions to the side. And so when we avoid or invalidate our emotions, then actually it can cause harm. And that's why we call it toxic positivity.
Gotcha. Okay, that seems to make a little a little more sense. Thank you for that. I'm wondering, do you have any more examples that you might be able to share with us?
Sure. If you don't mind posting that slide up for us, we'll run through a few.
Here we go.
Here we go. Slide number 1. So here are some examples, Tyler, of toxic positivity. One is hiding what we really are feeling. The next is an example is dismissing our emotions. We can feel guilty for feeling guilty for our negative emotions. Like, for example, tell ourselves, well, I shouldn't feel that way. I shouldn't feel sad. I shouldn't feel bad. Shaming ourselves is another trick that we play with ourselves sometimes with our negative emotions. Like, for example, what will other people think of me if I have these sad feelings or bad feelings? Minimizing other people's experiences by saying it's not that bad. So if you're talking to someone else who's going through a difficult situation, so it's not you personally going through it, but someone else, and you're engaging with them, and you tell them something like, oh, it's not that bad, or here's another classic one, oh, it could be worse. Because you're trying to cheer that person up, trying to make them feel better, but an unintended consequence of telling them those things is that it puts a damper on their emotions. They should be allowed to feel the emotions that they're feeling, in other words, and also showing others different perspectives. For example, telling someone, well, everything happens for a reason. Okay. Now, what I'd like to do is give you a few examples because this is a biblical thing. I've noticed that there are a number of people of faith who are guilty of toxic positivity. Not necessarily that it's intentional, but it just kind of happens. And I've got a few scriptures here to share with our audience today concerning toxic positivity, but mainly in the area of lamenting. So people can feel sad. We're allowed to in Scripture. Sometimes people of faith want to think that, oh, I shouldn't feel these bad things because of who I am in God, my relationship with God. If I had such a good relationship with God, I wouldn't feel this way. But in Scripture, we see over and over again occasions where people lamented. They felt bad. They were sad. And really that's okay. They're experiencing life. So some examples that I've listed here today is Psalm 22, verse 3. It says, the psalmist writes, oh my God, I cry out by day and you answer not, by night and there is no relief for me. So sadness there. Another one is Job. You know, we see where Job lost so many things in his life, his family, his possessions. He lost pretty much everything, and yet he struggles with it. And so we see an example of that in Job chapter 3, verse 11. He says, "Why did I not perish at birth? Come forth from the womb and expire." Why didn't I just die at birth? In other words, he's saying he's so sad, he's so overwhelmed and overcome by his circumstances. He expresses that in a lament. And another example, familiar with probably most everyone who's watching today, and that is found in Mark chapter 15, verse 34, where Jesus is dying during his crucifixion. He says, and the scripture says, and at 3 p.m, Jesus cried out with a loud voice, Eloi, Eloi, lema sabachthani, which means, my God, why have you forsaken me? So there's biblical precedence for giving us space to feel sad and lament, and that's okay.
Mac, I want to thank you for drawing this topic out, because I know that I have had times when I can remember I was going through a new diagnosis, and it was something that was profoundly upsetting to me. and it was disturbing. And I can remember I was talking with a friend, and they came back and they said, "Oh, it's not that bad. Oh, you don't need to worry about it. You know, it's going to be okay." And that was exactly the opposite of what I needed them to be right then. And so it's being told that it's okay to actually experience and live into something instead of having to feel like you're less than, or you're weak, or maybe your faith isn't strong enough or whatever because you were going through a tough time. Um, so I just want to let you know that I really appreciate the topic and it resonates with me. So the question that I have now is, what can we do to cope in a more healthy way if we are maybe recipients of some of this toxic positivity, or maybe if we are some of the givers of toxic positivity to others?
Okay. Sure. So I'll answer your question at both those prongs that you gave us. One is if we ourselves are dealing with it, or if we're conversing with someone else who's struggling. So concerning ourselves, we need to recognize that our emotions like anger, fear, anxiety, worry are completely normal, especially during a pandemic. This has been an overwhelmingly difficult year for, I believe, everyone. I've heard people say that some people have said, about the pandemic and everything, worldwide, a global event, that we're all in this boat together. And I believe the Pope even said something, Pope Francis said something along those lines early on back in like March. But I've heard other people say, well, that's not quite accurate, but it's more like we're in the same storm together, but we're in different boats because different people are having unique struggles, that my struggle may not be like your struggle, or may not be like someone else's struggle, but we're all going through the same storm together, but in different boats. So I kind of even like that example even better. But in this tough event that we're all living through, we're all experiencing all sorts of emotions, and that's okay. We should be allowed to tell ourselves, that it's all right, because this is anxiety, worry, fear. Those are all normal responses to a very abnormal situation that we're going through. So it's important to remember that the expectation or the goal of feeling positive. Instead, we need to accept whatever genuine feelings that we're having, to allow them to occur, to sit with them, and then eventually those feelings will pass. The trouble again we run into is when we try to push those feelings aside or suppress those feelings. That's when we're going to have even more problems over their hands. So finally, we've got to realize that we aren't to blame for everything that happens to us, um, and so we aren't solely responsible for the solution either, right? Um, so we may feel like, well, I'll be able to pull myself out of this. I just need to think correctly. I just need to do whatever. Sometimes, if we're going through a tough time, sometimes it's best to reach out to someone for help. And so I want to encourage folks to do that. We need to recognize our limitations, and it's okay to ask other people for some help if we need it. And so that's when we're dealing with toxic positivity. But when we're interacting with someone else who may be struggling, here's some things for us to all to kind of keep in mind. First is that realize that their problems are real, and it's normal for people to feel sad, angry, worried, frustrated, helpless. That's okay. The next thing to keep in mind is that we all want to be heard and understood. We need that. So be patient with people that are going through a tough time. You may or may not be able to relate, but just sit and listen to them. Allow them to express their emotions, and don't feel like it is your job to make them feel better. A lot of times we want to do that, right? We don't want, it's uncomfortable to sit with someone who's going through a tough time. And so our response to that is to try to make them feel better by saying things that can be harmful. Allow them to express their emotions, sit with them, and acknowledge that it's not our job to just make them feel better. And also, I've got some suggested responses, if you don't mind putting that next slide up on our screen. So here are some possible responses if you're dealing with someone going through a tough time and you want to give them good responses and not make it toxic. Here are some things that are possible statements. One is, I'm sorry to hear that you're going through what you're going through. How can I help? And when you put that question out there, how can I help? If they say, well, I need whatever, fill in the blank, then if you say, okay, then make sure that you follow through with whatever it is that their request is. Okay? Be ready to do that. Here's another possible response. It must be a really tough time right now, and sincerely mean it. Another one is, it's normal to feel overwhelmed and confused in your situation. Another, I don't know what to say, but I'm here for you. And I think that one is just probably the best statement that you could make. I think just letting people know that you care and that you're there for them, and to me, that's a true friend. And then finally, you're not wrong for feeling the way that you do. It's okay to feel. Give them permission. It's okay to feel sad. It's okay to be angry. It's okay to be confused or hurt, whatever it is. It's okay. And just sit and listen to those folks. That's when they really need it.
Mack, I want to thank you. This is a fantastic topic to bring up, and I think that some of these things, um, I can't speak for anybody else but myself, but I often find myself, I want to be the guy that fixes, and I want to make things all better. And sometimes I struggle with responses like, I don't know what to say, but I'm here for you because I don't feel like I'm doing enough. And I know that a lot of us got into healthcare because, I mean, that's why we're here. We want to make people better. And so sometimes I think that you're exactly right. There can be a temptation for us to want to try to fix the situation. And sometimes we just need to be content with just sitting alongside folks where they are. So, Mack, again, thank you for agreeing to join me today and to share your wealth of knowledge and bring up and introduce a really timely and important topic for all of us. And again, I want to remind everybody of the fact that your chaplains, whatever facility you're in, are available to you as staff members and as providers. We're not just here for the patients. We're certainly here to help the patients as best we can, but we also want to make sure that we're doing our best to minister to you all as well. So don't hesitate at all to reach out to a chaplain to set up a time to talk, or just grab one of us in the hallway for a quick curbside conversation, because we're more than happy and we want to engage with you all as well. And thanks for joining us for today's conversation. And Mack, again, thanks for being here. And we hope you have a fantastic afternoon. Have a great day, everybody.
All right. Thanks, Tyler. Bye-bye.